The government has created a health service commission to counter the shortage of healthcare workers in the country. According to Health Minister Elias Kapavore, the country is short of 20,000 health workers, and this is one way the government plans to boost health workers in this sector. Jaheb Akia reports.
This is nothing new, the shortage of healthcare workers. This is despite the fact that hundreds of nurses, community health workers and other medical professionals graduate every year. Minister Kapavore highlighted the fact that the health sector is not meeting its required quota of 4 health workers to 1,000 patients.
We need 40,000 health workforce in our country. At the moment we are short by 20,000. Population requirement, requires that 4 health workers equals or must serve 1,000 population. 4 health workers must serve 1,000 population. At the moment, only 1 health worker for 1,000 population. That's a gap of about 3 or 4. That's the gap that we are now trying to meet. And I want to say today, the government of Marapiroso last year committed more than 230 million kina to fill 7,000 positions. This year, again, committing 800 million kina to make sure that more than 10,000 positions are filled, the entire PHS in the country. So the government is committing fund. It is up to our PHS to make sure that they have the structure correct, connecting with the DPM and making sure that the positions are advertised.
To counter the continuous shortage of healthcare workers in the country, the National Executive Council has deliberated and agreed to create a Health Service Commission. This will be something similar to the Teaching Service Commission. The Health Service Commission will be responsible for ensuring all health workers being trained have a job waiting for them when they complete their studies.
But because we identified that there's some gaps or some slowness in recruiting some of these healthcare professionals, the Cabinet has made a decision. Cabinet made a decision to establish a Health Service Commission in the department in connection with DPM, so that any health workers who graduate from any health school in our country must be directly deployed to a position waiting for them, not having to wait for a position to be advertised before they get deployed.
Minister Kapavore says there are many challenges ahead, but he is determined to ensure the plans under the Medium-Term Development Plan 4 relating to the health sector is carried out. Jaheb Akia, NBC National News, Port Moresby.